So you've decided to give Lonsurf TAS 102 to your patient with refractory metastatic colon cancer. Let's give you a quick refresher on what we do here at Lombardi Georgetown for these patients. Mohamed, take it away. New patient, Lonsurf, how do you do it?
Sure. So I have to admit that our experience with Lonsurf is still relatively new, so we're still learning along the way. So the approved dose, which I use it in my clinic, is 35 milligram per meter square. Remember, this is a cytotoxic drug, so we use it by body surface area, but also we have to make sure that physician knows that there is a cap on the dose. So 80 milligram is the maximum dose you can do it twice a day.
So do you go in, do you do the BSA, do you calculate, you get a dose? Because it's split dose and all of that, right? So what do you do? How do you do this?
So usually we have a calendar for patient and we mark when he's gonna start. And the way we do it, we calculate the body surface area, 35 milligram per meter square, and it depends on how much comes. So if it is 77, we round to the nearest 5 milligram. And then we have to say, okay, how many pills of 15 milligram you get and how many pills of 20 milligram you get.
So I'll tell you, I don't ever send them off with 2 prescriptions. I always use the one that gets closest to the milligrams that I'm recommending, so there's no confusion. Have you been doing that, or are you doing 2 pills?
You are a lot wiser than me. So,
so you're still doing it?
I think eventually I will do it way, but right now I'm using the approved dose.
Main things you're telling that patient for toxicity, top 2 or 3 things that you got to tell them.
I actually warn them first. You have to follow up because we need to see them frequently. You need to check their count because, as you know, myelosuppression is the key in that drug, and we have watched them very carefully. Also, make sure you know if you have a fever, you need to call us right away. Because of possible neutropenic fever.
Yeah, some nausea in some patients. You put that on the list?
Yeah, nausea, vomiting, diarrhea, but those very, very, very mild.
So they feel pretty good. The toxicity is not too bad, but the myelosuppression, they have to take it seriously.
That's true.
We come out of the door. We give you sometimes 2 prescriptions, depending on pill size, for this medicine. Complicated schedule. How do you take it from there?
Yeah. So with this one, it sort of takes a lot of patient education, especially depending on the person. Because it is confusing. Sometimes they're going to have 2 types of pills, and then the dosing is day 1 through 5, and then 8 through 12, and then 2 weeks off. So I write it all down on a calendar for sure, because they're going to have to remember that dosing, so it's confusing. And then I also go over specialty pharmacy type things, copay assistance, because they're not going to take the drug if they can't pay for it, if their copay is ridiculous. So I go over all that kind of thing. And then I also reiterate side effects, because especially like he said, this one is really important with the myelosuppression. I don't want these people at home with low counts having fevers and not telling me. So I tell them communication is key.
Focus, go ahead, sorry.
No, I was going to add something. One of the things actually I found work very well with this patient, when you have the medicine in hand, come to the clinic and we'll walk you through this. So we sit with them in the room, we teach them this is how much you should take, how many, how often, so on and so forth. So we reinforce those instructions.
So it's not just a simple prescription that you send off. You have to stop. You do a lot of patient education, calendars, calculate the dose, 2 pill sizes or 1 depending on your strategy. Monitor for myelosuppression, importantly, watch for nausea, vomiting.
So.
That's how we do it at Lombardi Georgetown for Lonsurf TAS 102.